Thank you so much, Dr. Ramesh. So, we now have an understanding of what causes cancer, uh, what is the entire process of carcinogenesis, or the growth of cancer. We also have an idea about what kind of symptoms are associated with cancer, as well as diagnostic considerations. Now that we have a basic structure around what cancer is all about, could we start getting now into the preventive aspects of cancer? And so here, uh, Dr. Ramesh, would you like to throw some light on preventive strategies, focused mainly around screening for cancer? Over to you.
Coming to the topic of prevention of cancer, screening of cancer, it is very important for us to understand that cancer doesn't show up on its own. And it is very important for us to realize that cancer is going to happen and we are all susceptible irrespective of age or gender. Having understood that, we also need to realize that screening tests are done on normal persons like you and me. Frankly speaking, as of now, prevention is possible only in one cancer, that is cervical cancer. Regarding the rest of the cancers, all the tests that we are attempting to do, they are attempting to detect the disease at an early stage so that we can start treatment early and hope to cure the patient of the disease. But ideally, what we wish is prevention, and such thing is possible for cervical cancer only, where we have simple tests like pap smear, colposcopy, and so on that help us identify pre-cancer changes, the changes that occur in the body much before cancer has developed. Now, having identified those cancers, those changes, then we can institute treatment on those changes so that we can actually prevent these changes turning into actual cancer. So, prevention is possible only for cervical cancer. Similarly, the HPV vaccine that is used also prevents cancer by preventing HPV infection. Whereas in the case of breast cancer, where we do mammography, in case of prostate cancer, we do PSA, or in the case of intestinal cancer, where we do endoscopy, upper GI endoscopy or lower GI endoscopy, what we are trying to do is basically identify a lesion at an early stage so that you can take a biopsy, prove that it is cancer, and start treatment. So that is early detection of cancer, whereas in cervical cancer, what we are doing is prevention of cancer. So the government of India is encouraging screening for cervical cancer, breast cancer, and oral cancer, because these are the most common cancers found in this country. So we suggest that women above the age of 30 to 35 years need to become conscious about the possibility of breast and cervical cancer, and hence they should start doing breast self-screening, self-breast examination, mammography annually, and pap smear or HPV vaccination, as the case may be. In men, we encourage a PSA test after 50 years. There is no single test for all cancers, and depending upon the age of the individual and gender of the individual, we suggest various tests.